Welcome to Your Infinite Health. Are you getting older?
Are you feeling it?
How would you like to do that in reverse?
We're your host,
Dr. Tripp
and LeNae.
We've run an integrative medicine practice for 13 years.
Together, we have 60 years of combined experience helping clients.
We've helped tens of thousands achieve success in health and live longer, happier lives.
In this show, we'll cover peer-reviewed and evidence-based integrative approaches to creating the health you've always wanted.
We also share professional experience we see in the field every day.
So if you're ready to feel, look, and live your best life, you're in the right place.
Welcome to Your Infinite Health podcast.
Hey, Tripp.
Hey, LeNae.
I had another doctor prescribe me anti-gloating cream.
Anti-what cream?
Anti-gloating cream.
Anti-gloating.
I can't wait to rub it in.
Got it.
Oh my gosh. Okay, I cracked myself up. When you were making the transition out of oncology care into integrative medicine, I think somewhere in a nearby city or maybe across the town, another physician was closing his office, and that physician ran a pain management clinic. And so because that guy closed, and I could have my facts wrong here, but because that guy closed and there was nobody in the immediate area facilitating pain-specific care, you ended up with kind of this class of patients. They all seemed to know each other. It was like they kind of came in on a bus all together at the same time.
Right.
Specifically for pain management.
Right.
And much to their chagrin, you had other plans.
I had other plans.
Because we sometimes get calls for people wanting to know if we do pain management. And very early on, I kind of said, we do not do pain management, because in my mind, the word management in that respect meant keeping up with the status quo. Like just managing pain, not really doing anything proactive
to get rid of pain,
to alleviate, reduce, eliminate, or heal the pain. I don't like using the word heal either, because I think different people have different ideas of what that means, and you don't want to confuse anybody. But you ended up with this bus of people.
And to be correct, that was because that physician, because I did so much pain
care with oncology. You were really good at reducing, reducing pain for your cancer patients. And so that's kind of how.
And so he gave my name out as one of the potential physicians that could.
Okay. Yeah. Okay. So we don't do pain management, for clarification. Never have, never will. But we do provide pain relief. And we do that by helping resolution. So reduction and mitigation and resolution. Why don't you tell the listeners about that and your thoughts on that? Because the opioid, people get addicted to that. It becomes a big problem. I think where we are, I don't know, are we on some sort of belt of traffic for opioids? I don't know, but it seems to be pretty prevalent in this geographic location.
Yeah, I think it was nationwide, and that's why there's, over the past decade, so many new initiatives have taken place to try and curtail the use of narcotic medications, which have been the source of people actually killing themselves by overdosing from prescription medication, and not just using opioids as recreational drugs out in the market. So I think as we inherited that tribe,
right,
that was seeing that other physician, by the personalities and the individuals coming in, I could kind of categorize them initially as drug seekers without a cause, and those trying just to get the drugs, versus those individuals who had significant legitimate issues with pain and who the long-term effects may have been compromising and added to the addiction and the drug-seeking behaviors. So those two categories were very interesting. And in the context of doing the integrative medicine and doing the approach that we do at Infinite Health, I found very quickly that just doing the 4 pillars approach, the mind body with using the optimization process and all that.
Well, and for Tracy in Wisconsin, our 4 pillars approach addresses nutrition, physical fitness, exercise, metabolic hormones, and the mind body coaching program.
Thank you. And so that is so part and parcel to any patient coming in and me accepting them for their pain, to deal with their pain issues. I said, well, this is part and parcel to this program. If this is not for you, then you need to seek a different physician. And the initial, that probably cut about 20% off right away. And then it was interesting how things went subsequently, because those who had significant issues and really only wanted the medication so that they could really have reasonable lifestyles, as we implemented the program, the 4-pillar program, what happened is that I was able to really significantly decrease the amount of pain medications that they were receiving from the other physician. And sometimes there were long-acting opioids along with short-acting opioids, and mixed with sedatives and muscle relaxers. And
good God, were those people driving?
Yeah, and all these people are on the road. So that was what was initially very gratifying. I saw that those people were really interested in just having a decent lifestyle and being able to minimize their narcotic and medication use, really benefited from the program. And then subsequently, those people who were more pure drug seeking, in that those people were fairly quickly sorted out with the parameters and the guidelines that were required by doing the mind body component and doing the other components of the program. So I ended up with a population that mostly was patients who had legitimate problems that were really benefiting from the integrative approach. And ultimately, as we subsequently added the stem cell approaches and the prolotherapy and those more direct approaches to musculoskeletal disorders, had a huge impact on what we've been able to accomplish with these folks.
What would you say was one of your best case studies from somebody who came in strictly wanting pain management but got baited and switched? Not that we were baiting, but they came in for one thing and we were able to enlighten them to other options. Like, what was one of your best case studies?
Yeah, I think one of the individuals was an entrepreneur, electrician contracting.
How old?
50s, late 50s, or early mid 50s at the time. And he was on, I think, significant doses of Percocet, oxycodone, all the muscle relaxers and all that. Primarily had back pain and degenerative back pain. And as we initiated the 4 pillars, I think the mind-body component had impact. He had certainly the nutritional aspect, changing his nutrition to a low-inflammatory nutrition lifestyle had huge impact. I was able to change him off of the oxycodones to maybe the hydrocodones and get rid of a few other little peripherals. And then following that, he accepted, I think he had back and shoulder issues. And so I did a PRP procedures on his shoulder and his back, and 2 or 3 procedures on each one. And we eventually subsequently were able to decrease and discontinue all of his narcotic medication.
Wow.
And that lasted for, he had a trauma. So at one point I had him totally off his narcotics. I got him off his muscle relaxers, and he was doing really, really good. He lost a significant amount of weight. But at one point he fell back into the low-inflammatory nutritional lifestyle, and things went backwards again, and he started having more pain. And so again, I pushed back, and he was able to get significant pain relief by changing his lifestyle again. But I've had a number of patients like that actually. But he came in and said he was actually able to get out of bed without having to take pain medicines before he got up. And after we did the pearl therapy on his back and with PRP, he actually said that he was able to get out of bed and walk to the restroom just like a younger man again.
Aw.
Yeah, it was great.
So that was a really great story, and you have several of those.
Mm-hmm. And several of those, actually. So
cool.
So that was, I think, became the premise of our program there. And there were a few other patients that we lost that had somewhat adapted to the four-pillar approach, but did not really benefit and weren't benefiting. And so I actually
weren't benefiting because why?
Because they were actually
drug seekers.
They wanted it in a pill. They didn't want to do anything for their.
How many of those people you think were like selling?
Well, and that's the using the drugs to sell to other people is diversion, I think that's called. And so that was another concern of mine. So I actually terminated a patient who was not using his medications properly, and it looked like he was doing that, or she was doing that. So yeah, there were a few of those too. Unfortunate though it was.
Yeah, but I know that pharmaceutical companies are under scrutiny for providing misinformation to physicians, like way back when these things became pushed on doctors.
Right, these are not addictive.
Right. So that's underway, and it's really exciting though to see that we have these modalities that are natural to the body and completely eliminate the need, right? Or significantly mitigate any need to be on any of those addictive, harmful prescription medications.
Medications, correct.
So that's really exciting.
The regenerative aspect of some of these approaches is just phenomenal. And the pain relief in attending the results of the regeneration are significant, so that medication reduction can be achieved, and it's not by, for example, there are a number of procedures out there that cut nerves that go to those areas, and so that they're numbed but when you cut a nerve, you're disturbing more than just the pain pathway. You're disturbing the motor pathway and other things, the sensory pathways that are useful to have. So those types of procedures, and that plus the use of steroids, these procedures, the regenerative.
Oh yeah, I wasn't thinking about that, but I think you should touch on that. We got some time on the issue with steroids as a mechanism for pain.
Yeah, there are meta-analyses out now. I think steroids for pain control of joint disorders, and that even though on occasion they work very rapidly and shut down and make patients more comfortable, the end result is that they actually aggravate and expedite the deterioration of joints, insertions, muscles, all these things, and can actually be the cause of necrosis, bony necrosis.
Oh my God.
Yeah, I mean, there are literally meta-analyses with hundreds of thousands of individuals where they look at the benefit of steroids, or they've compared the benefit of steroids versus physical therapy, for example, or certain procedures, orthopedic procedures. And the conservative approach has actually been advocated because of the absence of potential damage or accelerated degeneration in the area that was evaluated. So there is so much information out there now that tells us that we should not be using steroids to control pain, but simply because of the physiology of what happens when we apply the steroids. We actually, in administering a steroid to a painful area, a damaged area, what happens is that our repair mechanisms, the ability of our bodies to repair a site that's been damaged, actually depends upon inflammation being present, so that it can activate the pathways that activate the stem cells and the repair mechanisms that repair the damage and also call in cells and support mechanisms from outside the area to help repair. So as we shut that down, we actually shut down the ability of the body to actually go to the area, or all of our biomolecular mechanisms go to that area and repair it.
Wow.
Yeah. So, I mean, just it's totally, in my mind, it should be contraindicated at this juncture.
Crazy. And yet it's not. Like,
it's not because it's paid for by insurance companies.
Got it. That's a perverse incentive.
Well,
it's bad medicine.
It's just perverse.
Violate the Hippocratic Oath.
Yeah, it's just
technically, right?
Yeah, first do no harm, right? So, but insurance companies are not
first do no harm unless you get reimbursed by insurance.
Right. There you go.
Sorry, listener, that was tacky.
Let's cut that.
Okay, cut that. Totally cut that. Cool. All right. Well, thank you for touching on that. I think it's an important topic for people because I think also those things are, some healthcare providers are very quick to pass the pill out to, I don't know, alleviate the symptoms or whatnot. So
our physicians are actually we're the ones that are responsible for that attitude. I mean, look at what we've done to promulgate the agenda of insurance companies and pharma. What we're doing is we're saying, yeah, okay, well, since we're working for the insurance company to get reimbursed, and we're getting reimbursed less and less and less because they're always trying to cut their compensation for physicians, then basically what happens is that we become much more efficient at doing things. So we see people quicker and quicker. How can we see people quicker? We give them a pill as quickly as we can and don't incentivize them to actually help them repair themselves. So we're working for pharma and we're actually working for the insurance companies. And that is the modality of the practice of medicine now that is actually driving decision-making. It's financially based, but I get not the capitalistic system, but at the same time, we're not taking into account what we're actually creating and the detrimental health environment that we've created, because all of these patients are inculcated into the system. They believe they can go in, see a physician for 5 minutes, get a pill, and be cured.
Right.
And that's, if we think about the people that are, the vast majority of people are maybe not necessarily in the acute setting, but in the chronic setting, are going in, getting the 5-minute visit, and we're not addressing the lifestyle measures, the things that we were actually taught in medical school that can actually benefit those people and shut down the pathway for detrimental health.
So passionate of you.
Yeah, get off my soapbox.
Okay. I think these are things that need to be said, and there are things that need to be heard. So thank you for sharing. And we're out of time.
Oh.
So, listener, I hope you found that helpful, valuable. If you have any questions, feel free to reach out to us at yourinfinitehealth.com. And until next time, stay healthy.
Thanks for subscribing to Your Infinite Health. I'm Dr. Tripp.
And I'm LeNae. Until next time, feel it, look it, and live it.